Ken Landau. Thanks for watching. Let's talk about Adderall. Adderall is amphetamine. Amphetamine is licensed for use in the United States only for ADHD and narcolepsy. It's very frequently abused as an athletic performance enhancer, a cognitive enhancer. It's used to give people a sense of euphoria, or it's used as an aphrodisiac. But those are all inappropriate and can lead to a lot of trouble. The amphetamines were first synthesized in the 1920s by a chemist looking for a treatment for asthma. He injected himself, felt well, couldn't sleep. And that morphed over a period of time into the 1930s, when the drug as Benzedrine was used to elevate the mood and boost the energy and improve the vigilance. It was even dispensed to troops in World War II, and afterward it became Benzedrine, used for depression, Obitrol, used for appetite suppressant. By the 1970s, there were about 10 million regular users of the compound, the amphetamine, and the FDA stepped in and said, nah, we got to do something. And it sort of lost its popularity. And then in the 1990s, an entrepreneur took Obitrol, added some other amphetamine salts, changed the name to Adderall, and poof, there it came, right on the market. First as an immediate release form, then later as a 12-hour extended release form, and most recently as a 16-hour delayed release form. Now, you can become dependent on the drug, both psychologically and physically. It can lead to addictive behavior. It was originally released in 1996 as Adderall. The FDA put a strict limit on how much could be produced in the United States, and they blew right through that very quickly. They had to increase the amount that was legit for production. How does the drug work? Well, it's a CNS stimulant. It's a brain stimulant. It acts by increasing the amount of dopamine and noradrenaline floating around your brain. And it decreases the reuptake by the nerve cells. And the real reason it works is it stimulates a gene to produce a protein called delta Fos-b. Delta Fos-b is the master control protein for all addictions in the brain. So it doesn't make any difference whether we're talking about alcohol or marijuana or cocaine or methylphenidate or nicotine or heroin or the amphetamines or sex or food or a high-fat diet or a lot of sugar or exercise, whatever you're addicted to, chances are it all filters back to delta Fos-b. Well, as far as ADHD was concerned, a psychiatrist in Rhode Island in 1937 came up with the idea to treat some otherwise unruly kids with the Benzedrine. And they seemed to improve. And all of a sudden, now we have a new diagnosis. So that's how minimal brain dysfunction, or MBD, was generated. And that changed in 1968 to the hyperkinetic reaction of childhood, which then itself changed. In 1980, it became attention deficit disorder, either with or without hyperactivity. 1987, attention deficit hyperactivity disorder. Then in 1984, again, attention deficit hyperactivity disorder, but you had to have it prior to age 7. And in 2013, they loosened it still, so you had to have the diagnosis before you were 12. And you could have mild disease where you just barely made the criteria, or you could have severe disease where you had a whole lot of symptoms, or you could fall with moderate disease somewhere in between. And the diagnosis was loosened up a bit, and then it was said that the condition could continue on into adolescence and adulthood. Well, now we have a situation where they're proposing that you can be diagnosed with symptoms that begin as an adult. So you don't even have to have it as a kid anymore. Actually, ADHD is the second most common long-term diagnosis in the pediatric population, second only to asthma. And remember, once you have it, it's going to last basically forever in at least 50% of the people. So in the old days, in the 1990s, Well, there were about 3-4% of the pediatric population diagnosed with this disease, and that slowly increased so that by 2013 it was 11%, in 2017 more than 15%. National Institutes of Mental Health, NIH group, National Institute of Health, they say it's 4%. In 1990 there were about 600,000 children. Now that's over 4 million children with the diagnosis. More than 16 million prescriptions for these drugs prescribed every single year, and it all depends where you happen to live, how likely you are to have the diagnosis. So if you're in Nevada right now, 1 in 16 kids diagnosed with ADHD. On the other hand, if you're in Kentucky, that number surges up to about 20%. Now we're at a point where even 2 and 3 and 4-year-olds have the diagnosis, and a significant number of them, several 100,000, are receiving treatment with amphetamines at age 2 and 3 and 4. More common in boys than in girls, and once you get the diagnosis, chances are you're going to be treated about 50% of the time, treated with some kind of a medication. Well, the diagnosis of ADHD is mostly left to pediatricians and family doctors who are rushed and harried, and unfortunately they don't have enough time to devote to making a correct diagnosis. A correct diagnosis requires some thought and some planning and some discussion with the teachers, with the parents, with other individuals. So the GPs just make the diagnosis when the parent comes in and says, little Johnny, little Annie, they're not acting appropriately. Sounds like it's ADHD to me. Well, what are the symptoms? Well, the hyperactivity, impulsivity type, you have to have at least 6 symptoms, at least 6 months duration, fidgeting and squirming, running around, climbing, seeming to be on the go, blurting out answers in school, leaving the seat, difficult time with quiet activities, excessive talking, can't seem to wait their turn, or intrusive behavior. That's how you make the diagnosis of attention deficit disorder. And for the inattentive type, again, you need at least 6 symptoms for at least 6 months, lack of attention to details or careless mistakes, a poor listener, poor at organization, you lose things, you forget things, you have a lack of sustained attention, failure to follow through on certain tasks, you avoid tasks that require sustained effort, easily distracted. Again, that's screwy that you make a diagnosis and then give a kid amphetamines for the rest of their life because he's fidgeting. Well, in the United States, we believe this is a neurologic disease. In France, on the other hand, they believe it's a behavioral disease. How common is it in other countries? Not very. In Japan, less than 1.5% of the population. Actually, Adderall is illegal. You cannot prescribe Adderall in Japan. And you can't prescribe any drug for treatment of attention deficit hyperactivity disorder prior to age 6 or after age 18. In the United Kingdom, about 1.5% of the population. Finland, about the same. In France, it's about 3.5%. They rarely use drugs. They believe it's a sociologic condition, not a neurologic condition. They don't allow drug company advertising in France. Drug companies can't define disorders in France. And for whatever it's worth, you can spank a kid. You can't abuse a kid. There's a fine line of differentiation. In France, if you abuse a kid, you go to jail. If you spank a kid, that is okay in France. Well, on studies that were done with attention deficit hyperactivity disorder and Adderall, the studies were of short duration, at least initially, but 80% of the kids who met the diagnosis of ADHD seemed to do better. They seemed to benefit from the treatment. They had better relationships with their peers and with their families. They performed better in school. They were less distractible. They had an increased attention span. But they also had an increased number of side effects and problems with the medicines. Seems like the medicine was safe and effective for at least a couple years. Seemed to increase the quality of life, increase the academic performance. But since it increased the academic performance in kids, now we have a problem. And the problem is that people without ADHD are using these drugs as cognitive enhancers. There's a whole field now, we call it cosmetic neurology, or neuroenhancers, smart pills. These are pills that are being taken by kids who don't have anything wrong with them, who are overcommitted, who want to have better performance at school. And as a result, they take drugs like this, but they seem to need higher doses of the medicine because it's only in those kids who have significant abnormalities, who have ADHD, do the drugs really work. But now we have, even in places like BYU, that's about as staid a college as can be, we have significant abuse of Adderall in the time immediately before examinations. And kids don't necessarily consider using these drugs cheating. They're used as study aids, they're used by adults to gain an advantage at work. But study at Maastricht University in the Netherlands shows that, well, you get a small benefit in memorizing a set of items in a controlled circumstances, but they're of no help in the real world. And if you want to memorize something, you'd have to take another pill every time you want to sit down and try to memorize. And remember, the dose that you need for recreational use, and that would include as a cosmetic enhancer, is probably going to be higher than the therapeutic dose, and that can lead to significant problem. And as a matter of fact, these drugs rank only number 2 to number 1 drug, which is marijuana, as an illicit drug used on a college campus. The reason why people use them is because they think it's a benign way to be more productive. They think that there's a pressure for them to excel, and if other people are doing it, why shouldn't I? They don't want to be left behind. Some of them because they have one of those tip-of-the-tongue moments where, oh, I just can't remember. Well, you take this pill and supposedly you can remember. Well, for some individuals, there's improved cognition. The working memory is a little bit better. The attention's a little bit better. Memory consolidation can be a little bit better. Recall can be a little bit better, but for short periods of time. Unfortunately, yes, indeed, they can make you focus on a task and need less sleep. But if you need less sleep today and you don't sleep tonight because you're keyed up because you took the pill, chances are tomorrow you're not going to be able to concentrate, so you're going to have to take the pill to get through the day because otherwise you're going to be tired, and that's how the addiction begins. And just because the pill can make you focus doesn't mean it focuses you on what you want to focus on. So you might take the pill and all of a sudden you might focus on cleaning or focus on organizing your closet. Or you might find that instead of writing a 3-paragraph essay, you're writing now one that's 10 pages long. The benefits obviously tend to be very short-term, and unfortunately, it seems to help those people who have ADHD feel normal. But if you're already normal and you take the drug, then you have the chance of having some degree of euphoria that can lead to other kind of problems. And the drugs are used to improve athletic performance. They help the muscles work well. They help the muscles work when there's less oxygen. So after you've been running a while, these are the drugs that give you that extra endurance. They decrease the onset of fatigue. They improve your reaction time, maybe improve your acceleration or your strength. But they do that at a cost, because they can override some of the safety mechanisms, and then all of a sudden the body temperature can go up, and all of a sudden you can start developing muscle breakdown. So these drugs are banned by the NFL, the NBA, Major League Baseball, the NC2A, and there's a risk of addiction with these drugs, obviously. And some people, for whatever reason, crush them and snort them or dissolve them in water and inject them. It leads to all sorts of awful problems. If you take the drugs, you can have some side effects. Side effects might be mild, like a dry mouth or insomnia or a headache or emotional lability. Sometimes fever, nervousness, dizziness, anxiety. Sometimes they can increase your blood pressure, increase your heart rate, cause you to faint, decrease the circulation to your fingertips, cause spasm in the blood vessels. Sometimes they lead to erectile dysfunction. Sometimes they lead to frequent and prolonged erections. They can lead to some gastrointestinal problems, nausea, abdominal pain, loss of appetite. Certainly weight loss was one of the original uses of the drug. They can lead to blurred vision, grinding of the teeth, nosebleeds, profuse sweating because they raise your body temperature, and if you have a history of epilepsy or seizures, decrease the seizure threshold, and if you happen to have coronary artery disease or heart rhythm disturbance, you could end up with sudden cardiac death or a heart attack. In people who have bipolar disorder, they can lead to mania, hallucinations, and delusional thinking. And they can cause a variety of psychological problems, from irritability to grandiose thoughts to wakefulness when you should be asleep, or they can lead to mood swings or difficulty with concentration or apprehension. And we know that somewhere around 100,000 plus people are going to be admitted to the emergency rooms this year because of taking Adderall. They're taken to the emergency room because they have paranoia or anxiety or severe depression or maybe convulsions or palpitations and arrhythmias and fever, malnutrition, tremors, muscle twitching, severe headache. Well, all of these things are possible, and unfortunately tolerance develops, and as you develop tolerance, and as the receptors for the Adderall or the amphetamine are in effect used to the drug being around, then you're not going to manufacture as many as of the receptors on the surface of the cell, and that's when you have to increase the dose of the medication, and that again leads to problems. And then there's another issue, and the issue has to do with withdrawal from the medicine. Well, you've been taking it, now you want to stop. Chances are you're going to have a withdrawal syndrome if you've been taking the medicines for a while, and it's going to occur within 24 hours, and it's going to last for 3 or 4 weeks, and it's going to come on in probably 9 out of 10 people taking the amphetamines, and it's going to have terrible symptoms during the first week. You're going to have the anxiety and the craving. You're going to have a depressed mood and fatigue. You're going to have a lack of motivation, increased appetite. You're going to have sleeplessness, lucid dreams. Better not take the drugs if you're pregnant. And half of all pregnancies occur before women are aware that they might be pregnant. So half of the people don't know they're pregnant for 1 or 2 months, and they can be taking these drugs, unfortunately going to affect the unborn. Shouldn't take them if you're breastfeeding. No studies show that they're safe. The drug companies say that the drugs are safe. They say that the fears of side effects and adverse effects are highly overblown, but I don't think so. I think there are legitimate problems with these drugs. Now, drug company advertisements have increased dramatically. So, for instance, in the Journal of the American Academy of Child and Adolescent Psychiatry, a journal directed to those individuals specializing in pediatric psychiatry, over 100 pages of ads in a year for these kind of drugs. The drug reps, when they go to the doctor's offices, don't talk about the adverse effects of the medicine, just about the beneficial effects of the medicine. Lots of publicity about these medicines. There are advocacy groups for attention deficit hyperactivity disorder. Even the American Psychiatric Association gets a significant amount of funding from these drugs. And guess who makes the guidelines for treating and for diagnosing ADHD and for deciding whether it's a condition that goes on into adolescence and adulthood or even starts in adulthood? It's the guidelines writing committees of the American Psychiatric Association, and guess what? 62% of those doctors are receiving some kind of grants or funding or honoraria or other kind of money from the drug companies. And the FDA says a lot of the drug company advertising is false and misleading. And now we're getting to a point where there are so many people taking the drugs, and the drugs pass from youth into adolescence into adulthood, that we have sustaining market for the drugs, increased number of people taking the drugs, and they even now have gotten to a point where you can take an internet survey to see if you have symptoms of ADHD. And almost always the answer is yes, you do, irrespective of who you are. So the New York Times did a study. They took 1,000 people and had them go to the websites. And 50%, more than 50% of those people were diagnosed as having consistent symptoms with ADHD. And these are just otherwise normal individual people. Well, the problem is that so many people are receiving these diagnoses, and there's so much power in the hands of the drug companies. It used to be that the sales of these drugs was about $1 or $2 billion a year. Now it's well in excess of $9 billion a year. The cost for the immediate release Adderall, $100 cash. If you want the brand name, it's about $400. If you want to buy the extended release, the 12-hour extended release form, that's about $200. If you want the 16-hour release, cash price is about $320. You can buy them for a discount if you have a coupon that you can get at GoodRx. But these drugs are dangerous. And they're dangerous from the time you start them, and especially people who are taking them for recreational purposes. And the quality of the evidence to support their use tends to be relatively slim. And so many of the people who are writing the articles suggesting all of these wonderful benefits are reaping financial rewards from the sales of those drugs. And even the guidelines writing committee, as I mentioned, those doctors have financial interest in the prescription of these medications. And now we have a point where it's not only the kids and adolescents, now it's the adults getting the drugs. So, unfortunately, our society is highly over-medicalized. As we see patients from day to day, it's very rare, looking at the list of medicine that people are taking, that we don't see a medicine for ADHD or a medicine for anxiety or a medicine for schizophrenia or a medicine for some other psychiatric abnormality. These drugs should be used only when necessary and only for appropriate indications. Anyway, that's my point of view. Thanks for watching. I'm Dr. Ken Landau.